I'd like to start with you with what you're seeing out in the field in terms of those gaps, some of those pain points as it relates to that ECG monitoring workflow.
The normal consumer products are not convenient, as convenient for the providers nor the patients. You have to get the strips to a provider, which can sometimes be difficult. We have an older population that we serve. We have rural populations that we serve. So, they're less tech savvy. Trying to navigate through EMRs can be quite difficult for them.
So this, when we hear the continuum of care and these, and I said workflow somewhat, I don't know if it's synonymous or not. Nicole, are you seeing some of these similar gaps, and are those expectations from the patient being met? What are some of those pain points you're seeing as well?
I think that, to Missy's point, pretty much trying to get a hold of a doctor, or no offense to the doctors or anybody out there, but it's very difficult to even get through the triage lines on a phone. And I think that as a consumer, being on the other side as a patient, that we kind of sometimes look at consumerism as we look at outside of healthcare and wonder, why is it not like that inside of healthcare? So I know when I'm a patient or my kids are a patient, I want to be able to get them treated at the lowest level of care very conveniently to make sure that they're, safely taken care of. And I think that there are some barriers that exist in our continuum of care right now, and that technology, if done right, can help with that for sure. But that is definitely a gap we see right now, is we're not convenient for the patient or the provider.
So what is that? What is that workflow, or what is that process today that most patients are experiencing as it relates to getting those strips over to their doctor?
Sometimes they walk into the office with their phone in the hand, saying, "Hey, can somebody look at these strips?" Sometimes they're trying to email them through, our EMR system, that which does not come directly to the provider. Our MAs actually get all of our messages first, and then they're sent to us. So those could sit in the basket for long periods of time throughout the day, until it's sent to a provider to review. So, I think that, if you're trying to intervene, quickly for a patient, I don't think that would be a good avenue to try to get information over.
Is there a best practice today for how quickly patients are expecting to hear from a doctor once they say, "Hey, I might be in AFib"? Is it
Right.
hours, days?
Well, we have a policy that, non-emergent calls can take up to 24 to 48 hours to respond to. If you are calling in and your heart rate is, say, 170 and you're symptomatic, then we have a protocol or a triage nurse that basically says you need to go to the ER to be seen. And I think that having a device that can get the information to the provider quickly could help, try to get the patient seen in the office sooner, trying to get treatment to the patient sooner without an ER visit.
Yeah, I want to add on to that too. I think that, we were talking, some colleagues and I were talking about this the other day. We've heard a lot about value-based care and looking at outcomes and all of those things, but the problem is our system right now is set up to be very reactionary. It's not preventative. And again, like I said earlier, technologies can come in and help with that. It's important because, to Missy's point, it's the most expensive place to treat a patient is in an emergency room. No health system wants that. And if the only thing standing in the way is getting the data in her hands to make that decision, and she can make a determination to bring them in and treat them on the outpatient standpoint, that helps everybody, the payer, the patient, the provider, and then ultimately the outcomes, which is what we're really looking for.
So Jason, when you're out in the business world on the other side of this equation, are you hearing and seeing some of these similar challenges in the market?
Yeah, I think from the clinical teams and healthcare executive leadership I talk to, there's a lot of excitement about remote patient monitoring, at-home care, right? Whatever you want to call it. But there's also a level of caution because you're getting the experiences that Melissa started to highlight, where maybe they don't even call. They just run in and they're wearing a watch that signals something might be going on in the data, or it's a consumer grade device they bought at their local electronics store. And it's telling them something is going on, and they come in and, they either get admitted in to the hospital or, which is a good thing, right? But by and large, I'm hearing they're sent home. Hey, maybe reduce the number of cups of coffee you had this morning, whatever, you're decorating the tree at 11 o'clock at night, you're stressed out. They don't have access to the data, or they call their provider and set up an appointment. And by the time they get in, because it's non-emergent, it's a week later. Now the data is irrelevant if they even have a copy of it. So that right data or right information to the right person's hands at the right time is critical. And that's that clinical workflow that needs to really be embraced.
Very much so. So Melissa, are you seeing, I think you mentioned right at the beginning, people might walk in, and how many people have a cell phone or a smartphone today? A lot, clearly. Do the nurse practitioners kind of go, okay, I've got another device I have to figure out how to extract data from? It's something that the nurse practitioners are kind of like frustrated with these consumer products, or are we there? Are we not there? What's the state of mind as it relates?
Right. I wouldn't say that we're frustrated with the products, but when you've got somebody and you already have a full clinic and they're coming in and they're, I'll give an example. I was seeing a patient a few weeks ago, and his wife was not a patient of ours. And she's like, my watch keeps telling me I'm an AFib. What can you do about it? This had been going on for several weeks, she said, and she was very cheerful. But then trying to go through all of her data that she was trying to give over to us with working her in can be very time consuming and frustrating on both parties' side.
For sure. I just updated my Fitbit, and I immediately saw that, the upgrade now has a ECG capability in terms of, hey, we're going to alert you, when we feel like, you're in AFib or whatnot. And I'm like, oh, this is kind of relevant at the moment. And I walked through the whole process, and the length of disclaimers, and, the net of it was, don't rely on this data. And, meaning if you feel like you're getting a lot of data from us that's saying you're an AFib, you may want to contact your provider. And that's pretty much as far as it went. So Jason, as it relates to the Home ECG Plus solution, give us a little overview on what's different, in terms of how we're working on behalf of both the patients and the providers.
Yeah, great question. Well, first off, I mean, it's an all-inclusive device, meaning the device itself has the user interface on it. It has cellular capabilities built into it with the SIM card. So when a patient would receive this at their home, and the integrations we've done directly with an EMR would allow an order to come directly through, so we could ship a device to a patient's home, which I think is a really important point on the front end, which is trying to get to that Amazon model. The last thing you want to do is turn providers into distribution, break fix, procurement. They've got 500 devices on the shelf. Who's responsible for it? Space is limited already, right? And so we've taken that piece out of it, but make it simple. Someone can take this device out of the box, turn it on, and use it with the on-screen prompts. They don't need to read anything. We send a manual, of course, but from a consumer standpoint, they take the study, and at the end, it automatically sends it up to the cloud and along to their provider team and their electronic medical record. So from that standpoint, really seamless. From the provider standpoint, it's sending those notifications when there is a possible detection of AFib to alert the care team. Then he or she that's monitoring can go and click in that. And if they want to look at that tracing, the clinical grade ECG tracing we send, they can pull it up and look at it. And if it's a flag for AFib, or as Melissa can attest to, I mean, once you look at that, data, you can make a lot of different determinations with it. And so it's rich medical grade data within that clinical workflow for the clinical team that they can consume and make determinations on it by. So we believe it's extremely efficient. It's extremely valuable. It's that missing data point. A lot of places have deployed blood pressure cuffs, pulse oximetry, a scale. That's great. That's basic blocking and tackling. But this new physiologic data point, we're seeing a lot of people embrace it.